More than 124,000 people are in the U.S. hospitals today because of coronavirus. It's a record high again in the country. And 18 states report their ICUs are at more than 80% capacity, according to Health and Human Services. So at a time when our hospitals are overwhelmed, nurses who can travel to different places to plug shortages, they're in huge demand. Of course, it comes with benefits and some costs. Here's CNBC's Kate Rogers.
For Taylor Oakes, a pediatric cancer nurse from Tennessee, travel nursing was a dream.
You move to a new city for 3 months, live and get paid really good money to live and work there. So San Diego, Seattle, Arizona in the winter.
Travel nurses like Oakes are typically experienced RNs who take short-term assignments at hospitals to cover staffing shortages, often with little notice. And as hospitals struggle to keep up with the influx of COVID patients amid an ongoing nursing shortage, these travel nurses are in high demand.
We're swimming amongst a sea of demand. So every single available clinician is receiving 4, 5, 6 qualified job offers, and they really have their choice of where they'd like to go on their next assignment.
Hospitals are competing fiercely for talent, and salaries for these positions have skyrocketed. Some for crisis care jobs as much as $10,000 a week for a short-term contract. But pay isn't the only factor.
I would just offer that it's not just the prices that are attracting nurses to these facilities. It's safety, it's leadership, it's the ability to keep these nurses safe at home and at work.
For Oakes, who's on contract as a public health nurse on the Navajo Nation, these assignments come at a cost. While she's making more than she was as a staff nurse, she took a lower paying travel contract to work on the front lines of a dire situation.
I'm a pediatric cancer nurse in my normal life, in my pre-COVID life. That's what I do for a living. So it's not that I normally work like a super happy job all the time. I'm used to dealing with sad things. COVID's been very different just because of the volume of death and suffering that we have all experienced.
Staffing agencies tell us that every area in the country right now is seeking additional nursing talent as COVID cases continue to surge nationwide. But critics warn that it's often smaller community hospitals in rural areas that wind up losing out in these battles for talent because they just don't have the budgets of large hospital chains in the suburbs and urban areas. Contessa?
Kate, thank you for that. It's really eye-opening. Arthur Kaplan now, he's a professor of medical ethics at the NYU Grossman School of Medicine. I'm just wondering, Art, when you're looking at paying these traveling nurses to come in and help you with the short gap shortages, what do you make of the fact that the big hospitals can outbid the small hospitals?
Well, it's not fair. It's wrong. It's not the response we need in COVID. We want to obviously get the people to where the need is great. So if it's an underserved neighborhood in the inner city or a small rural community, they can't afford to bid in this open market to get the personnel. And by the way, there are doctors doing the same thing. I get ads every day now from companies, some of which are, just purely business motivated, that say, do you need this? Do you need that? If you can pay, we'll get you the help. But it isn't linked up to where the need is. And that's what's really unfair and not anything that I think ought to be driving how we distribute personnel right now.
Shepard Smith here. Thanks for watching CNBC on YouTube.